Hello and welcome to another episode of Home Care Hot Seat. Today I'm joined by Michelle Gorringe, the co-founder and chief operating officer of Newcross Healthcare Solutions, an independent provider of complex care in the home. She'll be discussing the Stay Safe panel she formed with her colleagues at the start of the COVID-19 pandemic to protect service users and staff, the challenges of providing complex care during lockdown, and the benefits of digitalisation. Thanks, Michelle. Thanks so much for joining me. I really appreciate it. You must be so busy at the moment.
Yeah, it's been I think probably in 25 years of business, I think this period that the COVID period, has been our most challenging time. And as a board, we've always worked extremely hard and long hours. However, I think this period has been absolutely exceptional, and I'm sure that everyone else within our industry probably feels the same.
Absolutely, they do, yeah. So I just wanted to start by asking you about the Stay Safe panel that you formed right at the start of the pandemic, that you formed with your colleagues. Can you just tell me a bit about this and how did the idea come about and what strategies did you have in place at the beginning?
Yeah, absolutely. So as a board, we decided that as the pandemic was effectively increasing in velocity, is that we would meet every day. And we did that all the way through the period. And of course, when you are looking at a business like ours, looking at strategy on so many different levels. So the board were meeting every day. And of course, within the conversation of the board and the clinician on the board were conversations around the clinical, the medical side of the business and the education that we needed to give to our teams, etc., to the measures that we needed to take. So I was already meeting with the governance team every day anyway. So I decided to put the panel together so that we could have a focused group, that I could bring in the board decisions, the strategy into the group, and we could work through the strategy from the medical point of view, the clinical side of the business, and actually just really connect the two even more closely than we were. So we decided to put protected time that we would meet every single day, choosing my head of governance directly as my right-hand man, or woman, and also my lead clinician, my lead nurse in the community, with also the service manager, the national service manager, the mobilisation manager, because of course we were still getting some referrals at that point very early on. So how could we mobilise packages safely, as well as looking at the safety of the clients that we were already taking care of. So that was the concept. Focus team together to connect with the board and to work with the strategy and the decisions that we had to make. So, for instance, the strategy with the company, we were not a company several months ago that worked from home, office-based around the country, over 60 locations. Plus all the central services that go with an organisation our size, such as marketing, accounts, etc. So we were not a company that had specifically set up their systems to be a home-based organisation.
Okay.
So we had to change very, very quickly. So we had to, very fortunately, we have our own development team that develop bespoke software for us and systems for us. So we had our dev team literally working around the clock to work with our systems to make sure that we could safely and effectively work from home. So we were testing each site, we were testing each department. So all of that was happening at the same time, of course, was the priority of making sure that we were able to give a safe service to our lovely people in the community. So Newcross has two elements to the business. We have our establishment business, which is where we provide staff on a temporary basis into care facilities. And then we have our complex care side of our business, where we take care of people in the community. And of course, we had to keep both services as safe as we possibly could. So we started with looking at, of course, as everyone else was at the time, we were trying to buy PPE. We were working with all of the Public Health England directives and also Public Health Scotland, because we operate in Scotland as well, following guidance, reviewing policy, rewriting policy. But in all honesty, the panel were reviewing and implementing and changing so frequently. We were very concerned about getting people confused, because the guidance kept changing for us. So that, I would say, in the first instance, was our major challenge, was to work our way through ever-changing guidance to give a consistent message that represented what we needed to do without, I think, layering on even more anxiety that was already there already. And of course, we hadn't been through, as no one had, a pandemic before. So we were learning as a team, we were learning as a board, we were learning as a business, and as we were learning as a nation on how to manage this really challenging time. And of course, sorry,
go on.
And also at the time, trying to provide the safest PPE that we could buy. And as you probably are aware, we had a lot of challenges around buying PPE. Some PPE that was being recommended for our service users, we were struggling to buy it. And so we had within our Stay Safe panel, we had a permanent chair with Brian, who works with us in purchasing, and he was literally, all he was doing was buying PPE.
When you formed the panel, it was quite early on. Did you have any idea of the challenges you'd be faced with at that point?
I think we had an idea around, I guess, the some of the clinical challenges that we would have with regards to the people that we take care of and their anxieties. So we knew that everyone would be super anxious. We knew that, as you can imagine, with our complex care service users in the community, they are the most vulnerable anyway, never mind in a pandemic. And you know, the last thing that they need to complicate their lives further is COVID. So we had a lot of heightened anxiety with the service, from the service users, but actually their families. And I think, unfortunately, with media, that every time they were watching, whether they were watching the news on BBC, they were seeing people wearing PPE, but they were seeing nurses and carers in hospitals wearing the whole sort of suits, and they expected the same, when of course we knew from guidance that was not the correct PPE for taking care of our service users in the community. So we were carrying out all of the assessments, risk assessments, working with guidance and giving safe PPE, but it sometimes didn't quite match up with what they were seeing on the media, and that caused a lot of anxiety. So I think that what we possibly underestimated was the heightening levels of anxiety and the number of conversations that we were having to have with staff and with families, where people were absolutely terrified. And it really, again, when you're managing a service like this and you are creating strategy, you do that with a very calm approach. Hopefully that's your intention. Emotionally you're involved, but you're trying to get, I guess, the safest way and in some respects, the simplest way, so people can understand what they need to do, and to have then the emotion of the heightened anxiety that our service users and their families had. I think it made the responsibility that we had even more heightened, because we didn't want to get it wrong. And we completely understood the anxiety, but we were trying to just do the best that we could, I guess, really, that's what I'm trying to say. But what we did very early on, with the strategy of having the Stay Safe panel, having a focused group, really communicating with our staff in a very simple way, so that people weren't confused. I think also the way that very early on as well, we took all of our education and we brought it online, and we set up Zooms, we set up webinars, we set up education hubs where they could dial in and get the latest information on infection control. They could be supported with how to just manage PPE, how to wear it, how to take it off safely. And we made sure that every single staff member was attending these training sessions so that we could educate them in the best way that we could without bringing them together in a classroom. I think that also was really beneficial, very, very early on. It was also very beneficial for us as a management team. We were attending webinar after webinar with the UK HCA, with the CQC, with the National Care Homes Association, because we also have a care home, which really helped us as well to really, I guess, to be knowledge-wise, I say at the coalface, that we were working it every day. So I think that also really, really helped us.
Yeah. With the anxiety that people were faced with, did you find that you were facing many cancelled care visits?
We had some. We did have some where, particularly with children, because we provide service to children with complex needs, and particularly with children, parents decided they would go it alone, and they wouldn't have the service in the home. So we did, absolutely, yes. In addition to that, people that we enable. So a big part of their planning and what we delivered was actually socially. So of course, community-wise, they couldn't attend the various groups that they go to the discos, to all of the things that we support people to do. They couldn't. So they did cancel some of their service as well. So we saw, in the beginning, probably around 10-15% of services cancel, which again, that took us by surprise. I must be honest with you, we didn't see that. That would have been a impact from COVID. On saying that, we've then seen a return to service, a return to needing our services pretty quickly, because families, as a family unit, it's a challenge, to take care of someone with complex needs around the clock.
Yeah, I was going to say, what kind of impact did that have on their health and well-being during that time, when you went around looking after them?
Yeah, from what I know from the communications that we've had and conversations, kind of on the ground from the teams, just anxiety. I think that the main anxiety was about how long this position of lockdown would how long would it take? Would it take a week? Would it be 2 weeks? Would it be a month? Would it be 2 months? And I think families were prepared. Okay, we locked down for a week, for 2 weeks. They could manage that probably quite well, but then when it was coming into the 4 weeks, the 5 weeks, the 6 weeks, obviously the period that we did have, that was a massive challenge for them. They were tired.
Yeah. So, how did you talked about the services that were cancelled in terms of the groups that they used to go to, and things like that. How did you keep your clients' spirits up during the lockdown? Well, how do you continue to do that?
I hope we still continue, absolutely.
Yeah.
I must say at this point, we have got some fabulous people out there. And I think that I know that there was lots of support for the NHS and for social care across the country. But I can't stress enough how fabulous these people are. I've seen commitment beyond commitment. I've seen care staff actually leaving their own families and moving into people's houses because the service user felt safer just having them there, as opposed to 2 or 3 people coming in to provide them with care. So I've seen people actually also separate themselves in their household from their families so that they can care. So I've seen some amazing, amazing people. But also what they did do, what I think is also really fantastic, is to try to keep up everyone's spirits. So there were lots of craft workshops. So we've seen some wonderful things that people have made that they probably felt that they could never have made. We have one young lady, and she made the most beautiful handmade cards because she wanted to send them to the elderly in her community. And that was to the homes as well, to the care homes, to make contact with the elderly in the care homes. We've got a young gentleman, and he's autistic, and he's wrote a screenplay with his staff whilst he's been in lockdown. So we've seen some fabulous things. I think there was lots of food involved, cooking lovely things, but lots of also using, like we are now on Zoom, FaceTime, using technology to interact with family, with friends, and again, just to keep, like you say, their spirits up. So we've seen that, and I think all of us now, we're looking at this screen today and speaking with you. It's become the norm, hasn't it?
Absolutely, yeah.
It's the way we're living. It's the way we're all communicating. It's where we're meeting now, responsibly so, using Zoom as opposed to meeting in groups in a physical meeting room. And I think it works extremely well. But I must say again, the care team, the nurses, the national team of nurses that we have, they've worked throughout this pandemic, and at great cost sometimes, I think, to themselves. And PPE is absolutely necessary, but it's really uncomfortable to wear for 8 hours, for 12 hours. To wear what they have to wear to keep themselves and the people they take care of safe is not comfortable attire. They're hot. It makes them feel thirsty. And I think you because of PPE as well, with wearing a mask, you're losing sometimes some of the impact of communication.
Yeah, that
you can't see the same way, which can cause anxiety and misunderstanding. So hats off to these guys. Exceptional, really exceptional.
Talking about PPE and the challenges that you faced, were you able to source much of the government supplies, or did you have to go to private suppliers?
It was very difficult. I think the intention was there by the government to provide us with the PPE that we required, but in reality, it just wasn't there. It just wasn't there, and we bought a vast majority of our PPE ourselves, and that was a challenge in itself. Like I say, we had people just buying PPE all day, every day, from wherever we could source it. And the cost was spiraling out of control. We were paying at some point over 800% more for masks, over 1,000% more for aprons. The same for the hand gels and gloves. Gloves became a real scarcity. So the availability of PPE item-wise changed literally day to day, week to week. 1 week we could buy gloves, then we couldn't. Then we could source aprons, then we couldn't. The masks were always a challenge. So the PPE side, I would say, for me, trying to keep our company safe, our people safe, was the biggest stress. I have sleep, and the NHS stocks, the NHS needed them. I was buying PPE privately, and then the delivery was not arriving. It was being rerouted to the NHS.
Yeah.
I understand, I guess. It was something that needed to be done, but in reality, we had people in the community that it was absolutely mission critical and necessity that our staff needed that PPE as well, of equal importance. We have people that we manage that beautifully at home that are ventilated. We need the PPE. So the PPE was a huge challenge, and again, as I said earlier, it gave our families a lot of anxiety as well, because they were seeing PPE, what they would see on the news, and they were wanting that PPE. And of course, what we had to do as a business is that we had to provide the appropriate PPE per individual, because we also needed to have, of course, the stocks of the PPE if we had a COVID outbreak, where we would change to a different mask, a different level of PPE. We had to have that in reserve in case we had a COVID positive case, which very luckily we didn't. We put all the time, we say that when we say we're COVID free, we do this. We're COVID free, and we do that every day when we meet, because that for us was again being responsible with the PPE that we could provide. And that was through risk assessment by our teams. We had remember that we had an occasion, and this is, at the time, it wasn't as amusing as probably I can look back now and think that was quite funny. We had a requirement for PP3 masks in a location for a particular service user. And we had, at that time, we were waiting for stock to come in. We had some, of course, we had our staff wearing it, but I knew we only had a few days, and this is how close we were running everything, because we had no choice, and our stock had been held up in customs. So we approached then, at that time, it was the emergency PPE portal from the NHS, and we asked for these specific masks, and they said, okay, communication was in hours, so it's quite quick. Okay, PPE's coming. So our manager, she was at home and home working, and outside the house pulled up a fire engine.
Right.
Fire engine came outside her house, so she's looking at the fire engine thinking, why on earth is a fire engine outside my house? And a very lovely fire lady got out of the fire engine, came to the doorstep, social distancing, and left a box. And that was our PPE. So she opened up the box, and in there we had 2 rolls of aprons, 1 box of gloves, no masks, and 9 Easter eggs.
Helpful.
So, yeah, at the time it wasn't amusing, but now we look back and think that was how, that gives everybody a real sense of the reality of the situation that everyone was in. We were all in the same position. So they were trying, I guess the chocolate was just to put a smile on someone's face when we couldn't get the mask that we wanted. So what we did with PPE as well, with what we could buy, we were buying at any cost. So we were paying at one point a mask that would probably retail around £5. We were paying over £20 per mask. We were buying as much as we could from where we could, but of course what we had to make sure was that the quality of the PPE was the quality that we required. That it had all of the documentation with the tests, of course, that the PPE has to go through to be suitable for certain conditions. So we became quite experts at looking at this information that we were receiving from all countries, from China, from everywhere that we were buying, to make sure that we were buying the PPE that had the right quality. And in fact, we did buy some gowns, the long sleeve gowns, that when they arrived, because we tested everything ourselves just to see, they were not the quality that we'd ordered. So we had thousands of gowns that they're now sat with trading standards because we'd been missold the gowns of the quality that we needed. So to manage the PPE that we could deliver to all of the locations that we operate across the country, the delivery services weren't there. So we created hubs, PPE hubs, north, east, south, that we had stocks that we would then utilise our community nursing teams, our care associate teams, and they were making PPE deliveries social distancing, of course, very safely. And that was sometimes logistics, how we had to get the PPE, to the locations. I think the challenge was the Isle of Wight. We had to get stocks to the Isle of Wight, so we had, I think we took literally the last car ferry that was going. We had a vehicle on there just with PPE to deliver to the island because we couldn't get some of the deliveries there. So PPE.
Wow. Okay, it must have really taken your attention away from what you should be doing, concentrating on care and all the time.
I think it didn't actually. I think what if there are positives out of this situation, is that I think we were even more focused on care than we've ever been, and we actually really are we're a company that we delight in taking care of people. It's a great passion of ours. I am a registered nurse by profession. And to provide care solutions for people that give them I guess it's probably a cliche thing to say, but a new lease of life, to enrich their lives, not just take care of them medically, is something that gives me great enjoyment. But I think that what this situation did, it brought me at the most senior level really into the centre of what we were providing as a care service. So I think that was a great positive. We re-rationalised how we worked with some of our systems. In fact, we rolled out a brand new monitoring system all the way through COVID. We put a new system in there that gave us greater visibility around the care that we were delivering. We re-evaluated how our teams were working, and I believe now that we've got an even more effective teams because of this. And I think it also, because of the conversations that the company that we were having, the managers were having with families and with the service users themselves and with the staff, I think it gave us an even stronger bond and an even greater understanding of how their lives really were affected by having someone at home with very profound needs. So I think actually, as a business, even though I believe that we were great before COVID, understanding, I think we've got an even greater understanding of the people that we take care of.
Okay. So it really brought home some opportunities for you then, the pandemic.
Yeah, I think so. I think so. I think that we've become even more creative on how we educate. We had from the very beginning, we had educate while you isolate. So we really promoted people educating and upskilling. And we had, 4,000 courses a week we were delivering, and still are every single week, that our teams were really wanting to be educated even more than they had before. I think it really helped, of course. They could do this from home. They were not having to obviously make a journey into an office, park their cars, etc. They could access around family life. They could access they could access the education then. But absolutely, education-wise, I think that was a really great positive. Also, that we've been able to be more creative. How we do that, and in fact we commissioned as well. We've got which is very unique to Newcross. We have what we call the virtual shift, and it's a virtual care experience that our staff undergo, and it tests them against the care certificate. It tests their decision-making processes when managing certain care and medical events. And we designed version 1 and version 2. One is for healthcare, one is for nurses, and they were operating in a virtual care home. So it took them through this whole experience working in the care home. And through COVID, we've been designing and working with the team of design. We're creating the community virtual care world that we've continued through COVID, through our experience of lockdown, and it'll be ready around October time, and it's fabulous. It's just an amazing project to work on, because I can see where we're going to get such a great value as a healthcare business with the people that we are recruiting, and making sure that they are absolutely suitable for the environments that they're going to be working in. And in fact, the community care is also now a greater project, which has come from this as well. We're creating the Newcross Care World, and we will have a whole world where you will come into the experience as a healthcare worker, as a nurse, and you'll be able to experience working in a virtual hospital, in a clinic, in all elements of healthcare. So from this period of COVID, we've seen how what we'd already developed, software, education, systems, and how now we can develop these even further. So again, that's a positive that COVID's given us, and what it's given us, we call it the art of the impossible. So we can do anything, we can take on any challenge now, and really rise to the occasion, and really think outside the box as to how we are going to deliver our service in whatever event. So again, I think it's allowed us to be even more creative than what we already were. But I think it's given everyone that works with us, the healthcare teams, the office teams that are managing the service, I think it's made everyone think about change and to just embrace it.
Yeah.
So much had to change in such a short time.
Yeah, that sounds really exciting. So are you completely digital now?
Almost.
Yeah.
Yeah, absolutely. Yeah.
And that's mainly come about because of COVID now.
We were on the trajectory already, but it put us in fast forward. We had to move at a greater speed. And as I was saying earlier, our dev team, our development teams were working around the clock over weekends. They have supported the business with new technology, new ways of, for instance, communicating with people through. We have an app called Healthforce Go, and that's how our teams, they work through their assignments through Healthforce Go, with checking in to make sure they're there on time and leaving, and timesheeting and everything else. And this part of our technology, Healthforce Go, has gone from a position of fear to fast forward, where it's so integral to how we work. And we can notify people of push notification, literally like this, real time. It's fantastic how we can now reach so many people much more effectively using technology.
Yeah, brilliant. So how did you look after your staff during the pandemic and make sure they were supported?
Well, I mean, of course, for the staff team, they needed support. So the conversations that my team, were having, just to allay anxieties and to just listen. Sometimes it just needs someone to listen to. In all honesty, that was taking a lot of their working day, their time, just listening to people and helping them with their anxieties. But also we have people, of course, that they had to isolate, and sometimes they had financial pressures because of that, with a partner wasn't working, so the household was under some financial pressures. So we set up the hardship fund, and this is where you could apply for a loan, absolutely interest free, and make repayments over 12 months. And those requests came through to myself and Tracy O'Kennedy, who is the employee experience director, and we would allocate the monies where we could. In addition to that, we created it's Medicash. So we signed up with Medicash, which is it's a health facilitation app, where you can access virtual GPs to get, obviously, advice about your own health, and also for counselling and support services. So we invested in that as a company, and we gave that to our staff as part of their benefits, to actually do that. I think a lot of it, Sarah, was just being close to them and listening and trying to give them, the best guidance and advice that we really could. And because we had such lovely things they were doing, that they were so committed to the people they were take caring of. We also set up, it's called Just a Little Thank You, and it's where someone has done something above and beyond, and we send them just a little thank you, and it's in wow points. So we send them £50 worth of wow points, and they can trade them in for cash, or they use them to buy things in the high street online, where they want to put that towards a family outing when they could go out and enjoy time with their families. And people are actually using them now, of course. They've accumulated these over the period in lockdown, but we just want to say thank you, which I think is, in all honesty, is the most powerful thing, when someone recognises you and says thank you for what you've done.
Yeah, and I think that'll really help with retention, I suppose, going forward, won't it?
Yeah, absolutely.
Did you have many new recruits come on during the lockdown? And
we did. We did. We were very fortunate, actually, with recruitment. So this is where I think that we predicted that recruitment would really slow down, and it didn't. It did the opposite.
Yeah,
really up. And I think again, media had a lot positively to do with that, because people were returning to care from other professions, and I think being within social care particularly, Aaron, I think it's never been as positively seen by the general public. So I think that encouraged recruitment. So yes, we saw a surge in people wanting to come and be employed by us. So of course, that again, we had our recruitment was in an office. We were seeing people face to face, and we had to take our recruitment within 48 hours out of an office-based environment and to interview. We were already interviewing via Whereby, so we were already doing that. But it was the rest of the process with the induction that we had to change, and we did that really successfully. We wrote a completely new induction program within 5 days and moved it into this sphere, which was incredible. And that was our learning development team. Again, they were working around the clock to make that happen. So yes, recruitment has absolutely improved. Again, I guess if you look at it as a positive from COVID, and the reputation of healthcare and social care now.
And because you're providing complex care, that training is quite specialist, isn't it? So how did you make sure those new recruits that were coming from different industries were ready for this kind of sector field?
We could, so the classroom-based training that we would normally have provided in the classroom, that of course went into the webinars, it went into the Zooms. However, as you so rightly say, some of the education training we need to have is very people specific. So our teams, our nurses still worked out in the field, care associates, who are the staff that we train to a very high clinical level, and they work shadowing our care staff, training our care staff and supervising them. But of course, with Newcross, we only take experienced people. So it's not as though we're taking someone that has never worked in care before. Absolutely not. It's freshers, as opposed to teaching them skills that they've probably never had before. But that continued. So that did continue with the service user, and we did have some of our trainers, they would be in a virtual classroom with the equipment, instructing and demonstrating to people that had used the equipment before but needed to be updated, basically. So we used a variety of means to make sure that we were still extremely safe. We were educating the teams to the level that we would have done prior to COVID.
Mm-hmm. And have you found that because of the media coverage of COVID-19 impacting care homes, Have you seen a big increase in people demanding care at home over the past few months?
That's an interesting question, because we've seen a big increase in the demands on our services. So we've never had as many referrals as what we're having now, particularly with children. We're getting a lot of paediatric referrals, but I think that's because we've kept the service COVID free.
Yeah.
We've been very, very close with our commissioners that commission the services, because of course we've been having lots of conversations with them around PPE, about strategy. So we've got closer to the people that commission us. So I believe that they understand even more so how we deliver healthcare, and they like it. And also with CQC, we've got a stronger relationship now with the CQC that I guess we've ever had, really, because I guess you're in it together, aren't you? You're trying to create, the safest experience that you can for people that are vulnerable in our society. So that connection, I think, is stronger than ever. So I think one of it is reputational benefits. That's why we are seeing an increase in referral, but we are seeing more end of life. Very, very sadly, we are seeing more end of life referrals for people obviously coming home to die, and I do think that's an impact from COVID, where people have not had the treatment that they would have had because they just couldn't, or they've not had a diagnosis as quickly as they would have had in normal times. So that is really awful to see and really sad to see, but we are seeing that.
Right.
I think that the confidence is coming back now in the care homes. They're starting to have admissions. I know my care home that we have, Green Tree Court, we're COVID free there as well. I kept that service completely COVID free. Same principles as the community care, PPE, education, and a really devoted team of people. But unfortunately, again with media, people weren't seeing that. They weren't seeing that actually some care homes, and I know quite a high number, they've kept COVID free through this whole experience, and have still kept that now, and have made great moves with buying PPE, again keeping the people in their care very, very safe. But that's not really been reported on, or I guess the general public have seen is homes reporting high numbers of deaths, and staff that are, I guess, overworked and underappreciated, and that's not the story for everyone. So back to your question, I think that we've seen an increase in referrals because of reputational benefits, but also end of life. Fortunately, there is a increased number of people requiring care because of that. And yes, I'm sure within those referrals there will be some people that perhaps would have gone into a care home but have chosen not to.
Yeah. Okay. The crisis is obviously still ongoing. Are you still meeting with the panel daily, and are you prepared for a potential second wave?
We're not meeting daily anymore, although this week I think we'll be meeting more than we did last week because of the quarantine rules that obviously that were brought into action over the weekend. So we've been working again with strategy, communication with our teams. So we meet now twice a week as a fixed meeting, but then we flex. So if we need a third meeting, we will put in another meeting there. Are we prepared? We're prepared, as I guess, as anyone else is, and as best that we can. So we have more understanding on how to keep our staff safe, how and where to buy the PPE. We've got greater stocks of PPE than we've ever had. We've got the education in place. We've got the processes, the policies, etc. We can turn the business now back to home working again, literally like that. So as a business, we are better prepared in that respect. But I guess we're still learning like everyone else is. So I think we are as prepared as we can be probably more prepared than some, but everything's changing still. Guidance is constantly changing. It's changing around immunity testing. It's changing around guidance with, thank goodness we've got the testing availability. So that again is a really important factor with the second wave, the spike, whatever you want to call it, is the fact our staff are now being tested every week. We can get our staff tested. We can isolate very quickly. We're now starting with the movement with the immunity testing for staff, all staff, and we're, from the government, there's a real push now for domiciliary care. In fact, I just had emails this morning about it, about access to immunity testing. So with that also, I think that makes us better prepared with testing and also immunity position of our staff. So we've learned a lot, and I think we're as ready as we could be